It is a huge honor for me today to be podcast interviewing Dr. Jack Fingrut, DDS, MAGD, certified dental consultant. Let me read his bio. Jack graduated in 1977 from University of Toronto, Faculty of Dentistry. He has practiced dentistry at the same address since graduating in Toronto, providing dental care to more than 34,000 individuals from ages under 1 year old to over 95 in general dentistry, endodontics, periodontics, orthodontics, exodontia, including impactions, surgical and prosthetic implant placement, and associated boney grafting. Dr. Fingrut has particular interest in marketing and how it might be used to maintain his business growth in one of the most competitive dental markets in North America. And I think it's so darn cool that not only do you have your MAGD, but your son's a dentist and is practicing with you. How cool is that?
I dreamed about that because that was all I want. I have 4 kids. So I was only able to convince one of them to do it.
Yeah, I have 4 kids. Are all yours boys, or do you have an assortment?
One daughter, yeah, she's a teacher, and one son that's a physician, and another son that does video recording for the American Association of Craniofacial Pain.
Now, where is that in? Where are they? Where is that organization out of?
I don't know. They have different conventions in different locations. Whenever they have a convention, he goes there and records their meetings, and then they produce DVDs to sell to their to people.
And how's that business going?
He's just doing it part time. He's also doing like weddings and other things where he records that, and he's also done some business videos for. He'll do like dentist technique video for one of the dentists in the craniofacial pain area, and how he does how he does stuff to get people in good shape.
Very cool. So I noticed in Toronto, it was a long time ago. A lot of the younger kids listening to this won't remember it, but I think it was like 15, 20 years ago, French Quebec, Montreal decided they wanted to succeed. And I noticed a lot of the legendary dentists in Montreal, like George and Faye Friedman, jumped ship from Montreal. So you had a big influx from Montreal back. How long ago was that?
94, 95.
Oh my God, that was 20 years ago.
Yeah, but that's not the first time stuff like that has happened. There's all sorts of. We had a great deal of American draft conscientious objectors during the
Vietnam War.
Vietnam era, and they all came up to Canada to avoid the draft. And I remember having a dentist as an English teacher in high school, and he couldn't get his license right away, so he was being an English teacher in the meantime.
But Toronto is a very competitive market.
Yes, it is. It's extremely multicultural. 40% of my patients speak English as a second language. So people who are of ethnic backgrounds or diverse backgrounds, they want to be here to be with their own cultures. So we have a very large Chinese community, whether it's Cantonese or Mandarin. We have Asian or Indian. We have extremely large, or Iranian, and Polish, and just Italian, and on and on. I can't. It's the most multicultural city, I think, in the world. So people want to be with their own friends and family and feel safe and secure, and so they're happy to be here.
Well, you got out of school 10 years before me. 97, you were 77, I was 87. So what would you tell, podcasters are generally young. They're usually under 30. What do you think is the state of dentistry today that you've seen over the last 4 decades that you've been practicing? Do you think it's headed towards corporate dentistry, high-tech dentistry? What are your son followed you into this, and he graduated into a dental market that's extremely different than it was in 1977.
Sure,
So
sure.
do you think it was dentistry was a better profession in 77 or 2016?
Well, when I was in dental school, I didn't choose it, but a lot of the people in my class dentistry was a plan B. Nowadays, it's because they want to get into medicine. Now it's a
Okay.
plan A. And also, when I graduated, I didn't wear gloves and a mask, and I was working for many years without wearing gloves and a mask. And I can't imagine nowadays not putting on. I put on gloves to greet my wife, and I feel like sort of like Michael Jackson was. Anyways, I can't imagine that it was it what now dentistry is totally um, a specialty of medicine. We are really oral doctors more than ever. At the time, I think it was more of a technician. There was very few things that we did or I did as a new graduate, and things have dramatically changed. I tell my patients when I graduated they hadn't discovered all the teeth yet.
I love that one. So, you say providing standard of care dentistry is not enough to compete with the spectacular oversupply of dental providers in most urban areas as well as corporate dentistry. What are your thoughts on that?
Well, you can't be just like everybody else. I mean, even if you look at my logo, it's like it's not a tooth. I'll just show you. I sent you something about my shopping bags. Even though it's the scary clown, it's not a dancing tooth. It's not a tooth with a tuxedo. It's not just you can't be a blur in the background. People have to distinguish you, otherwise they're just going to move away and go to whoever is closest or cheapest. So they have to realize that there's something different about you or distinctive about you. And I'll do anything that it takes to have people understand that the office is unique, and uh, uh, if they move away, that's fine, but they should be looking for things like wraps on the handles or proper sterilization techniques. A lot of in Toronto, nobody comes around and checks. They check tattoo parlors or restaurants for health department, but nobody comes into my office and checks to see if I'm even doing any kind of infection control. I know in the States there's OSHA and there's other things, but there's nothing like that here. So they just wait for a complaint. So, you know, since pricing, strangely enough, in Toronto is about the same for every dental procedure, which is also really weird, um, or even in fact for all Ontario, it's it's a lot of people want to compete or make money or make a living by cutting back expenses as much as possible. So people may well leave, but they might well understand that things are different once they've gone somewhere else.
So, why is the fee for procedures the same for everyone in Ontario?
Well, that's something. That's why I went to the States to join the American Dental Association, Dental Consultants, and American Association of Dental Consultants, and become a certified dental consultant. I want to find out why. Um, in our provinces, except for Alberta, my dental association publishes a fee guide. Insurance companies use that based on actuarial estimates to set up dental insurance, and they use that, and they say we will cover 100% of the fee guide. Say, so what has happened in effect is if you charge above the fee guide, and there's a high incidence of insurance because we have socialized medicine, so employers offer insurance, dental insurance instead of medical insurance. So the insurance companies will send back a note to the patient that your dentist is charging above the fees that are recommended by your association. So what has happened because of that is all of Ontario has become a preferred provider organization. I didn't know what that was. And we submit our fees electronically to the insurance companies, and it's really the most bizarre thing I've ever seen. There's no competition, it's a service. So people in downtown Toronto, let's say downtown Manhattan, I know dentists in the States charge based on zip code and their expertise or demand on their services. That's not the case in Ontario or eight other provinces except Alberta. Alberta, and I was seeing this as a dental consultant. Alberta had to cancel their published fee guide and prices because the association, the regulatory body, their college or licensing body, and the largest insurer are all one because it's a smaller province. So they were concerned that they might be involved with some sort of combines thing. But in other provinces, the published fee guide is something that the provinces love because it increases access to care. It contains the prices and allows insurance companies to provide a product that covers everybody.
Well, if that's such a great idea, why don't they start doing it with cars and houses?
No, I don't think
What?
it's a good idea
Why
because
don't why don't, and I know I was saying that facetiously, that if this is such a great idea in dentistry, why don't they
no,
do it
no.
to houses and we'll all live in the same house? There'll be more affordable housing. We'll all drive the same car.
Yeah, I mean that's very socialist. Maybe that's the problem. I always use the example of the OJ trial where OJ Simpson's A team of lawyers. They were all top-notch lawyers, and they got them off. They were really good. They didn't get paid the same as a new graduate, but that's what happens in Ontario. New graduates get the same billing as people in who are experienced. People in downtown Toronto, where their rent might be 10 times higher and their employment costs are 25% higher, and where they have to do advertising, is the same as some sort of rural backwater. So that's really frustrating for me,
And it's
especially
exactly.
because
Go ahead.
especially because it's been hoisted upon us by our own association, our own dental association.
So you say referring out to specialists is sending business away unless you don't have adequate training and or expertise to manage comprehensive treatment. What's your advice with specialists?
Well, there's still lots of work. Specialists train the students in our schools. In fact, many of them take away any of the endodontics and exodontia, so that our dental students are graduating without any expertise in a lot of things. They get the new graduates are brilliant and incapable of doing any kind of dentistry. And you know what, the GPR, the kind of things where they do an internship doesn't help them either, because again, you're just treating patients you'll never see in your office, people with that are ASA type 3, or it's not going to help you be a better dentist. There is, though, a university near you. It's University of Arizona that sends out its students to the social services free clinics, and and your students there at the University of Arizona get tremendous experiential training, which is excellent, and they don't have the specialists stealing away any possible training they have. Many people will graduate without having done a molar endo, or they'll share one canal on a molar with 3 students. So it's nonsense that people are graduating incapable of practicing dentistry.
Yeah, that's the dean of that school is Dr. Jack Dillenberg, AT Still, and I've gone on trips. He even pays for and sends their students to go to missionary dentists in Tanzania and Mexico. And I've gone on trips with the dental students, and I mean, we go to Mexico, and they would just they were so it was so fun because they would just work as hard as they can from 7 a.m. to 7 p.m. just because they had access to all these
Patients.
complicated cases and patients. And
Brilliant, brilliant.
in fact, I shouldn't say this on the podcast because it sounds bad, but they actually didn't have as much fun in Tanzania because their decay rate was so much slower because there was so much natural abundance of fluoride in the water
Wow.
that all the kids had fluorosis, and it was hardly. I mean, a bunch of us showed up to this orphanage, and there was hardly any decay.
Well, actually, I guess that's okay, but the fluorosis isn't good.
Yeah, but well, it's good in pedo. Those kids had great teeth. What if these kids are coming out of schools? What specialty areas do you think they should go into first, second, or third? Because they're usually coming out and they're saying, Howard, Jack, I got student loans. I only got so much time and money, and there's so many things to learn. There's TMJ, there's Invisalign, there's sleep medicine, there's endo. What areas do you think are would be the areas they should focus on first, the biggest bang for their buck, return on
Oh,
investment?
here because we have insurance, perio and endo are covered. So I would learn how to do perio and endo first, and then certainly other stuff too. But when it comes to practice building, like I mentioned to you, in the best source of patients would be emergencies and being able to deal with pain effectively. Somebody comes in, and first of all, you have to be open for them to come in. Somebody comes in and they're having pain, and you can relieve their pain. They'll come back. They'll be your patient for life. I have a friend who's an endodontist, and he charges double what I charge. So I asked him, how does that go over? Because the specialists do charge more. And he says, well, they're in pain. They're so thrilled that they're not having their tooth out, and their pain is relief. They don't question ever my charges, and I think that's the way to go.
And what's sad is, you have to change the attitude before you can change someone's altitude. And some of these kids just walk out and they just say, "Well, I don't like endo," and they're done. Or they say, "Well, I don't
Right.
like surgery. I don't like that. I like cosmetic dentistry." It's like, dude, endo is $1,000 bill. Insurance picks up
Oh
800 of those
yeah.
eight of those Benjamins, and just one flippant thought like that. Well, I don't like endo, and then they're off to all these other high overhead
Oh,
procedures.
that's a recession dog, because as soon as things go bad or south, or people lose their jobs, that's it. They don't do anything about that. They're walking around toothless because they have no money. But if they've got pain, there's no amount of money that gets in the way of them having it relieved. It's like I talked in my sheet. It's like having a burst pipe. They want it fixed yesterday. So they can't be running around with terrible, and they can't work or they can't do anything. And besides that, there's a potential risk. Um, any kind of infection in the anterior two-thirds of the mouth, that's called the triangle of death, can track up into the eye and cause blindness or death because
Yeah,
there's no blood vessels there.
one of my best friends. I mean, he did a extraction on a canine, and he did not give post-operative antibiotics, and it went to trial, and he lost for the maximum, the million. The newspapers tarnished him, his reputation. I mean, it just literally, it almost killed him too. I mean, he was just so. Yeah, but you're right. The upper canine to canine, those veins go back into the head without valves on them, so they can blood can go both ways. That's tough deal. When you talk about endo and perio, you said endo and perio because they're both covered at 80% by insurance.
Oh, 100%.
Are 100 endos 100%?
Yes, yeah. Most plans are 100%. It's under basic. So perio and endo are covered 100%.
Nice. In the states, 100% basic is cleaning exams and X-rays, and then endo and perio will be 80%. But I want you to go into perio, and this is kind of a long question because when you're taking advanced training in perio, some of these courses, like say LANAP, you're talking about to learn that LANAP, you're going to buy an $85,000 laser and another $50,000 in training. And then a general question, and that also is they're coming out of school $350,000 in debt. So they're asking you, Jack, you've been doing this 4 decades. Do I need $100,000 CBCT? Do I need $150,000 CAD CAM? Do I need for perio? Do I need $135,000 for LANAP? I mean, talk about perio, then go into high tech equipment since they're so debt burdened.
Well, I have a periodontist in the office that I have as an associate, and I was trained. I was trained as part of the mastership for the AGD. So they have physical, experiential training. There's somebody we did practice on pig heads, and then we went out and we did all the surgery, osseous and flap surgery, and then we had to do case presentations where we did multiple cases and show that we had to take photos of it and the such. But the periodontist doesn't use anything except the regular tools. And as an insurance consultant, if I found out that somebody was using the Lanap, I wouldn't approve it. So I mean, you have to be really careful about those things. You know, it might well be a good product, but often it's not sold in a good way. They'll use some sort of Excel program to show how you can pay it off because the salesman, and the salesman wants you to buy it. Just as an example, I have something called Veloscope in the office, and I love it, but I don't charge any extra for it because it helps me do a better job. To go out and buy something simply because some salesman tells you you're going to make money from it is ridiculous. And you don't need things that are, you have to have some healthy skepticism, especially when it comes from some of these salesmen. And some of the stuff is not even good. Some of it is snake oil. So you have to be careful about that because they're just salesmen. They'll tell you anything to buy, to sell you a $100,000 piece of equipment that they make at least $25,000 commission on.
So you're a certified dental consultant.
Yes.
And with the the Association of Dental Practice Consultants.
That's the one you lectured at, the American Association
Yeah,
of Dental Consultants.
it's with so they work with dental insurance companies. A lot of those
That's
dentists
right.
are dental consultants. So go into more detail. Why, if you were a dental consultant working for a dental insurance company, why would you not cover Lanap?
Because they would have a specific coding for using that kind of technique, which would be a laser, as opposed to because often it's a closed technique. So they would go by the descriptions in the coding. They would talk about flapping and removal of bone and things like that. The way the Lanap might work is that it's a closed technique, and that you're supposed to generate a blood clot and then coagulate it, and then you get bony fill. And it may well work if you but it's hard to imagine that you can get all the calculus in a closed technique. They may well tell you that the laser is specific for, or that laser is specific for removing calculus. There are some lasers that say they target calculus by the wavelength. So, but these are salesmen that are telling you these things, and these are people who want you to buy their oh so expensive machinery. So it's certainly a healthy skepticism, and sometimes cynicism isn't a bad thing.
What about upgrading? You know, these $25,000 pano machines at 2D to $100,000 3D CBCT. What do you think of that financial decision?
I think, well, I have one.
A CBCT? Or
Yeah, but only because I do a lot of implants. But if you're just graduating, there are local radiologists. There's a radiology specialty, and it's not that expensive if you really need one to just send it out, and they do all the work up for you, and they send you the software to read it. So why would you spend any money if and radiologists just do nothing else but radiology? You don't have to worry about. I remember I used to refer to periodontists and lose the patient. They would want them back for their own scaling, and you're just going to do the checkup to see if they have cavities, or they would never have them back because they would run out of money, or they would be in so much pain and hate you because you refer them to the periodontist. And the same thing, same kind of problem I was having with orthodontists too. I was referring and I wasn't happy with the final result because an orthodontist, as a specialist, wants to finish as quickly as possible, even if it looks like crap. And if the teeth are all straight, they take off the braces, they put the retainer, and they're gone because they get paid by the case. So the faster they finish, the fewer the visits, they win. So the more money they make. So, and then they come back to me and things are a mess, or they have TMD, or God knows what else is going on, or blunted roots, or loose teeth, or horrible problems, and I have to deal with it, and then they hate me because I refer to this guy. So that's why I have better control. I can make sure that the person's satisfied, and and the ortho is a great way to keep patients because I guarantee retention for 10 years if the person continues to come back for recalls. So the whole family is stuck with me so that they get their guaranteed ortho retention, so there's no relapse.
And when you and I got out of school, it was all hardwire fixed, and now the market is vastly going to like Invisalign, clear removable aligners. Where are you at? Are you old school stainless steel, nickel titanium hardware fixed, or are you doing a lot of clear retainers,
I
clear
have
aligners?
I have a scanner for that's the company Invisalign bought it, and it's iTero.
Mm-hmm.
So I have one, and I like it for some cases. But people who take the iTero courses without knowing about orthodontics, that's a problem because it has a very specific and narrow use. I mean, you can do a lot of stuff with it, but it's really anybody who tells me they want to do all sorts of weird things with Invisalign, I tell them, well, I don't do that, and it's really not going to work well. And you'll find that many people who do complicated cases with Invisalign will have to finish up with braces or start with braces and finish up with Invisalign because they can't do it entirely with Invisalign properly. And that's a big thing. They don't even look at cephs for the Invisalign people. They have people who are they're maybe dentists in Costa Rica looking at some of this stuff, but they really don't have anybody that's looking at the entire whole case, and they're looking for more of a cosmetic result that can be potentially a disaster, not stable or with other problems.
I
So
agree,
Invisalign's
and
a problem.
I see the same thing in all these short-term ortho cases where someone will go learn ortho in a really short amount of time, and there's but in my defense of these guys, there's very few ortho schools that teach kids ortho. I mean, most kids get out of dental school and haven't done any ortho. And then when you go into the dental meetings, I mean, I can't even go to the AAO. In fact, the American I'm serious. The American Orthodontic Association. If you're an orthodontist, you can't bring your husband there. I mean, he's not a member. He can't go to courses. I mean, it's an exclusive club, members only. So, I mean, like Richard Litt is the only board certified orthodontist who used to be the chairman of UCSFS, University of Detroit. He's got a course on Dental Town. I've done a podcast with him, but there's almost no orthodontic instructors. In fact, one of the biggest ones in America was from your neck of the woods, Brock Rondeau.
Yes, yes. And I've been to his courses, and he's great, except the problem with him is it's not as comprehensive as I'd like it to be. And I can see people also getting into trouble by sort of trying to fit a square peg into a round hole. You really have to, unfortunately, while orthodontics isn't that difficult once you know how to do it, you have to know what you're doing because you can get into big trouble. So your training has to be really comprehensive, and especially because orthodontists are very fearful of losing their market share. So that's why they keep it a closed shop. They're afraid, and I've been to orthodontic lectures because I'm from Canada. They don't confirm whether or not I'm an orthodontist or not. So I've gone to orthodontics seminars where they say only orthodontists can go, and I go, and then they talk about, it's like this closed door thing. It's like almost being at the Ku Klux Klan meeting. It's this closed door meeting. This is how we have to beat those dentists.
And but why don't endodontists say the same thing? Endodontists teach
That's
everything.
funny. Well, I
Oral
don't know
oral
why.
surgeons. I mean, any oral surgeon in town. If you say, "Can I watch you pull some teeth?" or I want to deliver a denture. Can I come watch you pull this?" And they're like, "Well, hell yeah." I mean, why do oral surgeons not care? Endodontists not care?
Well, oral
Pediatric
surgeons
dentists.
do care.
I know oral
Oral
surgeons
surgeons,
do care.
yes, oral surgeons do care because what else are they going to do except wisdom teeth? I mean, they don't do a lot of forward osteotomies, and actually, the strange thing is in Ontario, it's covered the maxillofacial surgery where you reposition the jaws and um, but endodontists, I'm not really sure why. I guess they're figuring that it'll make more work for them when orthodontists when general dentists sort of screw up and they refer to them and then they'll never do that again because it can be pretty frightening from time to time.
But
Um,
back to we were talking about kids coming out of school, $350,000 student loans. We were talking about high tech. You're saying you do perio without Lanap. But what about CAD CAM? What are your thoughts on CAD CAM? Because that's $125,000 machine any way you look at it.
Yeah, I agree with you. What you said is absolutely right. Where the you said this in the where it's a waste of time because when I do my scanning with my iTero, and I do it for Crown and Bridge, and I've done full mouth reconstructions with it, and I even do it with implants because they have scan bodies. I send it to a lab, and they do a top-notch job, and they're very reasonably priced. And there's a lot of competition for labs too. We can't send out our lab work to China like some dentists in the States do because it has to be Health Canada approved, sort of like the FDA approved lab. So and we have to charge separately for our lab fees. But they do a top-notch job, and it's so easy for me to do it. And because it's the iTero, I don't have to use the kind of retraction that I would normally do for crown and bridge impressions because I don't use cord. I use something called foam cord, and you just bite down on this styrofoam thing, and it's got an expandable PVC, and it pushes the gum away. The reason it's good is because it pushes the gums away. The picture that's taken, you can see the difference between the tooth structure and the gums. And because of the new materials, I don't have to get as far subgingival with my margins anymore, whether it's Emax or zirconia or porcelain fused to zirconium. I will often make it at the gingival margin or slightly above, and I never have those black lines that
And that's
people
made
use.
from Coltine Weldent Magic Foam Cord.
That's right. That's right. It's amazing. It's amazing because, but sometimes I get a bleed, so I'll use something like a Traxident or something that stops the bleeding. But most often I'm above the gum line anyways, or slightly, or just at the gum line. So the reason that's good for the iTero is because you don't need to do the. You can see like a guy who gets a model in the lab can't see where the margins end and the gums start unless you've pushed the margins away, the gums away far enough. So, but with the digital scannings, which aren't that expensive, they're and there's a new one coming out by Atero. I think it's $29,000-$30,000 US, but it's the results are spectacular. I was at a lecture. I've had it one since 2011, and I was at a lecture with a prosthodontist, and he said you can throw the crown and bridge across the room, and the bite's perfect. It just lands right in the on the tooth. The bite's perfect. The margins are perfect, and my periodontist has seen my anterior crown and bridge, and he said I can't detect a margin. It's just spectacular the results that I get. And with this one, you don't have to put on any zinc stearate, which is like a powder for some of those. The ones that mill their own is nonsense. I mean, why would I want somebody milling a chiclet in the office? And I took courses as part of my MAGD training on the, but I didn't see any value in it.
Well, what I understand is that well, first of all, I think the easiest way to become a higher quality dentist is just magnification. I mean, if you go
Oh
from
yes,
naked
of course.
eyes to loops, what I love about my CEREC machine the most, in fact, the main thing I like about it is just when I do the oral scan, I get to see my prep on a computer monitor. And that magnification of seeing your prep probably, I don't know, 30, 40 times bigger. I've never
That's
seen it.
great.
I've never seen it one time where I said, "Oh, that's good." You're always like, "Holy hell, what happened there?" And you're going back, and then endodontists tell me, the greatest endodontists say that right before they get ready to fill, they pull down that microscope just for a check, and sometimes they see a missed canal, sometimes they see some crud in a canal,
I
so
can see that.
magnification. And then the labs are telling me that when you set up an impression, they're averaging a 6% remake, but when you're sending them a scan, it's a 1% remake. So the magnification is no brainer. But I agree with you. Your dental assistant is not a Crown and Ridge laboratory technician,
No.
and so many of these dental assistants and dentists are they're buying CAD CAM and they're spending 3 or 4 or 5 hours doing the whole design, milling, staining, glazing, whereas a lab person, that works at a lab could do 50 in a day.
Yes.
So there's
Yes.
a huge learning curve, and I don't I love the oral scan, so you just use the iTero oral scan, then you send it to a lab who does the
Yes. Yes.
CAD CAM.
Yes. And you know what? It's tolerated better because it's not an impression. It's because I'm using that uh, foam cord. I don't have to give freezing if it's a non-vital tooth. I can have an assistant do the scan, and I can check it. I can have an assistant if I wanted to. I don't know if it's legal here, but I don't do it. Make the temporary. I use this 3M temporary that's already pre-made, that's light cured, and I fill it with their dual, like their material, and I put hurry seal on top of the tooth, so if it's vital. So I don't even use a cement. I use like those temporary crown and bridge stuff, and I fill these 3M temporary crowns. They look like teeth, and I just plop them on. I trim it a bit, have the patient bite together, shine a light, and I'm finished. I've got this light that's a 1 second cure for 5 millimeters. There's technology for you.
Wow. You also say if your office does not see children, you're cutting yourself off from the number one family healthcare determinator, which is mom.
You bet.
So you like working on kids?
No.
I love honest people. I, yeah, you're
Well, I
right.
love kids. I love kids, but I
So do
don't.
I.
But I don't like working on kids. But not because I don't like working on kids. It's because usually I have the parents sit in the room, so I get concurrent consent all the time. And I explain. I tell them what I'm going to be doing. I tell the child what I'm going to be doing, and I go through everything. It takes a lot of time, and then I give them tons of prizes, the kids, to bribe them afterwards. And I have that like carrot hanging out there, and so the reason I don't like it is because the mother is the one that's put the child in this situation where they have cavities. Because if you just brush the kid's teeth and not give them uh, Gatorade or I had a mother that came in and was giving her child Skittles for breakfast because it was fruit flavored. So so the
Now I
parents
wish she was my mom.
the parents are indulgent. The parents are indulgent, so they don't like their child suffering.
And it's
So
even worse in China. You know why? Have you been there? So they had that one kid per family rule. So you got a
oh, they
mom and dad's
overindulge
phone.
them.
So then you got each mom and dad has two grandparents. So you have six adults bringing this kid a treat, and the mom and dad and the grandparents all a traditional Chinese diet. They don't even have decay, but they're seeing all these snacks, these Hershey's, these Reese, and they're loving the children. They're showering with all these treats, and they just got black cavities on all their teeth. And
Oh,
and then
great.
they come in and they're like, "What is going on?" Whether it be obesity, cavities, diabetes, because China's their civilization's 5,000 years old. They haven't seen these things. It's these Western packaged treats that
Yes.
six adults are buying one kid, and it's
Wow.
just I talked to the first pediatric dentist in Hong Kong, the first pediatric dentist in um, Nepal, and the first one in New Delhi, back in the day, and they all told me the same thing. They go, "Man, these ancient Asian societies, they're just getting turned on to your guys' Western diet, and it's going to take them a generation to figure out that you guys have the worst diet in the world for decay, obesity, diabetes." So I want to ask you this: pediatric dentistry has really changed the United States because Canada already covers kids for dental under 18, and Obamacare, the Affordable Health Care Act, just mandated that health insurance is going to have to cover dental for children under 18.
That's so
Um,
fascinating.
I want to ask you, as a Canadian, Do you think America is headed towards the same single payer system in healthcare as Canadians are?
It has to be because that's the only way to control costs. And as much as I don't like that idea, um, there are problems related to socialized medicine, but really, how can people afford? Like, for instance, there's this new cure for hepatitis C, and it's $80 to $100,000 a person. And if you go to a private payer, they're going to say we're not paying for that because we didn't anticipate that. So then there are people in that kind of situation. But here, the government is paying for it. Um, so I mean, certainly there's things that I would prefer to not have, but overall, I'd like to see my health care and education to be number one.
I got to read you an interesting stat. The United States has 115 popular drugs that the price of exceeds the annual U.S. household median income, more than double the income of Medicare beneficiaries, and cost more than three times the average Social Security benefit.
That's right.
115 drugs that if
That's right.
grandma and grandpa were going to take it, it'd take all their Social Security benefits times three. I mean,
That's right.
yeah, yeah, crazy, crazy, crazy. How long do you think it'll take before the United States is on a single payer? The reason I say it's going single payer is because you go to the 20 richest countries in the world, Canada, Australia, New Zealand, Germany. So I mean, you go to the 20 highest median income household countries with the most stuff, and we're the only one that doesn't have a single payer system. So I don't think that Americans know something that all those hundreds of millions of people in all those other countries don't know. So I just think it's a matter of time. I mean, how much time do you think it will take?
I don't know. Ontario, which is the province I'm in, like a state, I remember when organized healthcare or socialized healthcare first came in, and the initial one was very much like Obamacare, where it was private insurance companies that were mandated to cover people based on a certain kind of uh, benefit where they would pay to the insurance companies, and people on social assistance would not have to pay that. And then within 10 years, all the insurance companies were gone.
Right, and that's exactly what they did in the United States.
So it's just started now in the United States. I'm sure within a certain number of years, they'll realize that what cut out the middleman.
Well, the
Cut out the,
the poison pill that Obama got through that I never see anybody talking about it or reading about it or whatever, but it was a genius. I mean, if your goal is to kill the United States middleman health insurance market, he did it with the no pre-existing condition clause. You can't have any pre-existing conditions, and nobody had any idea how many truly sick people there were that had been put off. And the Republicans thought hardly no one would sign up for this, and like 10 million people did. Their claims are two to three times average a healthy population, and they're just going under one by one. And so he gave him that poison pill of no pre-existing condition, which just kills insurance. I mean, insurance is an actuarial risk analysis versus moral hazard. And if you take away no pre-existing condition, then how do you have insurance? I want you to also comment on. You say if your office does not see children, I mean, if you have hours of business like the banks of the '60s, you won't even attract bankers. What do you think hours should be in a competitive market?
my office is open 7 days a week and weekday evenings till 9. You
What are your
can't.
hours? 7 days a week. What hours?
Sundays as well, Saturdays as well, and weekday evenings till 9,
But what time do you open?
9:30
So you're 9:30 a.m. to 7 p.m.
to 9 p.m.
till 9. So 9:30 a.m. to 9 p.m.
Yes.
So 11 and a half hours a day, 7 days a week.
Not Saturdays, not Sundays. Just daytime Saturday, just daytime Sundays.
What are your hours on Saturday and Sunday?
9:30 to 4:30.
So on Fridays, does that upset being open upset the Muslims, Saturdays the Jews, and Sundays the Christians? Do the three monotheistic religions who celebrate Friday, Saturday, and Sunday? Because I remember when I opened up my office on Sunday in 1987, there were 18 churches in my zip code, and 9 of them wrote me a letter.
Well, Walmart's open 7 days a week, and it's the way of business. Now it must be more difficult in a very religious, uh, monolithic society, but that's not the case in Toronto. Whatever religion there's somebody who doesn't have a holiday on that day or doesn't feel that it's that important. And if you're if you look at the hospitals, they're open, and that's another thing. When I was talking about emergencies, I'd say 10 to 12% of emergencies are related to dental in emergency rooms in hospital, and those are the people you want to get, if they can afford to go to you, because they're sitting in a hospital room and nothing is going to be done. Maybe they'll give them some pills, and that'll be it, and they'll still have the same problem the next day.
Yeah, in America, I've read the numbers that for the whole country, it's 8 out of every 100 emergencies are for dental, and all they do is give them Vicodin, Percocet, penicillin. I mean, that
Right.
doesn't do anything for the patient. And I always wondered, it's so bizarre. How can a hospital do open heart surgery, remove a brain tumor, and give me a colonoscopy, but they can't do a toothache on a tooth? Isn't that bizarre?
It's very bizarre, but that's why you have to be able to deal with emergencies and be open effectively.
I just can't understand why every emergency room of every national corporate hospital doesn't just have, a dental operatory for endo and extractions. I mean, just for pain. I mean, they don't treat pain. They just give 8 out of 100 Americans here. Take some opioids, even though, when I got out of school, there were 30,000. 30,000 Americans died each year in a car wreck. 30,000 died in accidents, like falling off a roof, and 30,000 committed suicide. And then out of nowhere, we got a new 30,000, and it went all the way up to 41,000 OD each year on prescription opioids. We just had Prince. I mean, we don't know for sure what we don't we have Prince's final record, but they're saying opioids. That's so. So it just doesn't make sense that if 8% of the emergency rooms are for dental emergencies, that you would give them an opioid when it's a reaching an epidemic crisis in the United States.
Even when I'm doing wisdom teeth extractions or after root canals on a hot tooth, and I do it all the same day, um, I give a combination of ibuprofen and Tylenol 2. I never go beyond Tylenol 2, and then only for a short period of time. And I give people my home number, my cell phone number. I might get, we have 200 patient visits a week. I might get a call every 6 months at my home.
And do you do that because in Toronto it's just cheaper after the root canal to go on the street and buy heroin, or
I'm in a neighborhood that where there's a lot of there's a pharmacy next door that gives out methadone, and there's a treatment facility right in my building. I do not give out. I used to think that the Toradol was pretty good, but nothing beats a combination of ibuprofen and Tylenol, because you can take them and they're synergistic and they do not interfere with each other and they don't create a bigger risk.
I'm looking
So
for some big changes from the DEA soon. I imagine. I mean, that this opioid crisis with
it's
Vicodin
terrible.
has been the number one prescribed drug in America for 2 decades. America
Here we're having
eats.
a problem with fentanyl and fentanyl patches and people robbing because of it, and they're converting it to all sorts of injections and things like that. And certainly Vicodin was a problem at one point too. All sorts of different kinds of opioids are a problem, and that's a shame because they're addictive. But there's a lot of things that are addictive.
Yeah, well, if you talk to an
Smoking.
anesthesiologist, if you go talk to an anesthesiologist, when they give a woman a once in a lifetime deal where they're giving her an epidural, and they'll use like lidocaine, no epi for the, I think, short acting nerves or long acting, and then they'll give a narcotic for the other ones, the long acting, and they'll use fentanyl, and they'll tell you, they say that they call it the one hit wonder, because they say when you inject that in the epidural sac, their eyes light up, and most of them say, "Oh my God, what was that?" I mean, I've never had it, but it's supposed to be really, really euphoric. You also say effectively dealing with emergencies is the best source of dedicated new patients,
That's
and
right.
orthodontics provided in general practice, not the specialty practice and recession proof. We've been talking about that. So here's the deal. So I'm gonna pin you down because we're both DDSs, MAGDs, but the podcast listeners are usually under 30 and they're specifically emailing me, howard@dentaltown.com, saying, okay, but I can't go out and learn how to place implants, sleep apnea, do Invisalign, get a CAD cam, make surgical custom implant guides. They can only do so much at one time. How would you prioritize their journey at school? I mean, you didn't get your MAGD in 1 year.
No,
That
it took a
that
long
took you
time.
that took you a decade. Could you put those in order? Well, your son is been out of school 4 years. Put that in order. I come out of dental school. What is and I got $350,000 student loans. What's the best return investment? Would you learn Invisalign first? Would you learn, surgically placing implants? Would you
No,
get a CAD cam? Would you,
no.
what? Tell
Learn how to
them
do endo.
okay. You'd start with endo.
Yeah.
I agree. And
And
endodontists
then,
have the lowest overhead in America. And like you said, when you're in pain, you just want her done.
and any price is
Yeah,
not
you're
too
not
much.
gonna. So you would start with endo. I
Endo.
totally agree with that. And then number two, I would say exodontia.
Yes, yes, of course. Because you need to give them an alternative. So there you go.
And you know where you can go pull 100 teeth for free without paying anybody's tuition? All these homeless shelters. That these
And
dental clinics, like Phoenix has three downtown charity home. One's for vets, one's for kids, one's St. Vincent de Paul. But you can the line outside the center for vets is usually the length of a football field, so you could stand there all day long. You could pull 100 in a
great,
day.
great, great. I think that's fantastic. I think 25% of my patients are African Canadian, and they have denser bone, and
Or what? Or African?
are blacks. I don't know
Okay,
what the
black people, and they have denser bone.
denser bone. So it's always good to know how to deal with that too.
And you know
Uh,
why that's you know how I can prove that's a true fact is
why?
if you're a big fan of boxing.
Yes,
One of the reasons all the heavyweight champions in the world are not Caucasian is those older guys say that the Europeans all have glass jaws, and you can
yes,
you can train this great fighter, and then he can go in a fight and get his jaw
and break his
busted
jaw.
in three people, and it's over. So
Yeah,
yeah, so boxing alone is proof that Africans have a stronger jawbone, no doubt about it.
not all of them.
Right.
I'm getting some from because again, multicultural Toronto. I'm getting actually a lot of Africans, Nigerians, Ghana's from Ghana, and they don't seem to have. I don't know what it was. It's the ones that were here or in the Caribbean seem to have gotten it, and I'm not sure why. But it seems to be, and some Mediterraneans do as well.
Well, I just lectured like last month in Johannesburg, South Africa, and I had dentists from Swaziland and we went over to Soweto. But I was asking them this question specifically. I said because it's an ethnic mix over there, and I was saying, you know, is it harder to extract a tooth on say someone from Swaziland than someone who immigrated here from Ireland or England? And they go, yeah, like duh.
Oh,
Hell
for sure.
yeah. So in Africa, all the dentists over there know it. So if you don't know it over here, okay. I want to ask you also say internal marketing is the best, but not enough. There is a whole new gold rush to stake claims to the prime real estate of new websites with top level domain suffix like .dentist or .dental or newly added to .com or .org. So are you specifically building new websites that
Yes, yes,
instead of just .com now you're .dentist or .dental?
yes. I've got multiple websites depending on my advertising. I'll just show you one. For instance, I've got my. Remember, I talked to you about this is a grocery bag because in Toronto they charge 5 cents for grocery bags. So this goes everywhere, and as well, so patients imagine recalls, hundreds of recalls or new patients every month, and it goes out there, and it has a QR code. So and it has a different website than my own website, and so I can use Google Analytics to see where my patients are coming from, and I redirect from this website. What is it? Toothdoctor.ca, because in Canada you can have a .ca, and it redirects so I know where they're coming from and where they saw it. So I have a different website for anything. and as well, and I've got this telephone number 1-866 Tooth Doctor. But recently in Toronto, it's an urban area, you get a telephone number that doesn't have the area code. You know, the proliferation of area codes because of faxes and cell phones and other things. So they're adding new area codes all the time. So I've got all of Toronto without an area code, and my telephone number is 310-4230. Because when is it time to see the dentist? 2:30.
Oh, wow. So say that again. What was the number? Or
310
310
4230.
4230. What's the marijuana joke? Was that 420? So we should name ours 420. Get all the stoners in there. So do they have legal?
And I have a toll-free number as well. 1-844-4230. You can phone me anywhere in North America. 1-844-4230. And then I've got the internet websites 4230.dentist and b4230.dentist, because it's much better to see me before your tooth hurts.
That's so cool. So are you doing all this marketing yourself, or do you use a dental marketing agency?
Doing everything myself, my website and everything like that, but I have a full-time internal IT person.
Right on, man. You're amazing. And how many operatories and dentists work in your? And is it just you
I've
and your
got
son?
my son and another associate, and I'm looking for another associate because she's pregnant. Oh, in Canada, you can take a year off, and if you're getting a salary, you get unemployment insurance for a year, and the person has to hold the position for you if you're pregnant for a year. And then so I had at one point up to 12 women over 5 years pregnant, and I had to hold their spots for them, and then train somebody else for a year, and then have them come back, which wasn't a lot of fun. Anyways, and then I've got a periodontist, part-time periodontist, 2 associates, and myself.
So
And
I
6
just learned. I
operatives.
just learned the other day that over 100% of all pregnancy gingivitis cases are found in women. I did not know that. Hey, so you also say why independent associations of dentists or franchise locations can beat corporate dentistry where independent associations of pharmacists failed.
Well, that's because I mean, if you remember, there was at one time IDA where there was independent pharmacists. They were afraid of corporate pharmacies, but they're selling the same thing. Whereas in dentistry, you're selling a service, just like the A team from OJ. If you can portray yourself or provide services or do other things that create a situation, you're not selling a product, you're selling a service. You're not the same as the grocery store next door where his price for bananas is cheaper, there I'm going there, or his price for watermelons are cheaper, or whatever else it is that you want, or if chicken's on sale this week, and you have women running around from place to place. It's always a service. So people are frightened of going to somewhere else. I have patients that have been with me since I graduated. I have patients who come back because they realize that I'm not the same. It's not like a McDonald's, and I hope I don't get in trouble for using their franchise, where you can get the same product in any kind of corporate store. It's an uncertainty. You're going to a corporate store, you may have somebody that's there today and gone tomorrow, and who knows what's going on there. But if you have like an owner dentist in a place who's there and responsible, then you know it's going to be constant, and especially if you had some sort of organization that would assure that people would have a certain kind of standard of care, it would beat because it's a service all the time. You would have, and I could do that with my 1-844-4230 or 4230.dentist, because then it could be like an emergency for every. You could have 100. You could have zones and have people sign up to stake that zone and have a referral from one number or one website, and then you'd have emergencies funneled to you, and nothing better than that.
So on Dental Town, we got 216,000 dentists from every single country on earth. There's 50 different forms, endo, perio, pedo, but one of them is marketing. You got to take a picture of that bag and go post that under marketing. I mean, really, it is really, really cool. And I can tell you have a flair for marketing. I think you're the first dentist I ever podcast interviewed that was wearing an ear ring, has a jacket with your logo that's not just a crazy little tooth. You seem like you have a flair for marketing.
Well, everybody has to have the logo. I have other things as well. Like, for instance, my higher end patients, usually they tend to have vision problems after a certain age. They need reading glasses. So I have my
I love it. Tooth fixer.
that's my license.
That's
And
your car license?
yes, yes, yes. Of course, and I've got a wrap on it with a different logo. And then it's got a magnifying glass, so for those people who
Nice.
usually have money, and it's about the size of a card, and it costs about the same as a card, and it goes in your wallet. And baby boomers, people with money, keep it, and so they know when they want to have their teeth fixed, they know where to call.
Will you start a thread on under marketing and post pictures of these? Because I think dentists would find it incredibly fascinating.
Okay,
Or,
sure.
or would you be afraid that you'd be sharing your trade secrets?
I have no. Why would I? First of all, in Toronto, when the prices are all the same, the only thing that people want to do is find out how they can do things cheaper.
So what I don't understand with dentists is so you have a flair for marketing. You seem like you have a lot of personality, a natural flair for marketing. And when you ask a dentist to spend, 5% of their collections on marketing to get all these new patients, they say no. But then someone sends them a PPO, says, okay, we want you to do all your dentistry at 40% off. They say, okay. So they won't spend 5% doing what you obviously are doing so well. They don't blink at a 40% discount. Why is that?
They're desperate and they don't want to seem desperate because the only person that knows that they've got a problem is the insurance company.
Yeah.
Yeah.
So my last question is, do you think it's hypocritical that you're a dentist in Canada and you like hockey? I mean, how can you be a dentist and support teeth yet love hockey when they're knocking everybody's teeth out?
All Canadians love hockey. In fact, that's why the doggy style is the favorite position in Canada, so they can both watch hockey.
Oh my God, that's an awesome joke. I've not heard that joke. I actually watched my first hockey game in Toronto.
It's amazing. It's a great sport.
Yeah. I grew up in Kansas, so just wasn't a lot of hockey there. In America, in the 80s, it was a more northeast thing. But by the time I graduated from dental school in '87, I was 24. Hockey was just coming to the desert. We got a Canadian team that moved down here, and the Phoenix Coyotes. But yeah, I think I was 24. I don't know, however old I was in '90. I was born in '62, so I think 28. And I was up there for a course. And some dentist said, hey, dude, I got 2 tickets for the hockey game tonight. And I said, I've never seen a hockey game. And he said, what? And he took me to a hockey game. My God, that's fun, especially when you're there because it's just such a
It's so
faster
exciting.
game. It's nonstop.
It's the fastest game ever,
Yeah.
and there's fighting on skates. I can't imagine how they do that.
Yeah.
It's the most amazing thing
But what's
ever.
funny is when you're watching the Phoenix Coyotes on TV, whenever they pan the bench, I swear, every player on the bench is missing a half dozen anterior teeth.
That's too bad. Well, it's good for business.
Yeah. Okay. Well, hey, Jack, seriously, it's such an honor that you spent an hour with me at the end of a long day for you and me both. And I really enjoyed listening to you. I think you're amazing. Congratulations on your MAGD, your son following you into dentistry. And I really hope you go to marketing and post those pictures because I just think
Okay,
what
I'll
you're
do
doing
that.
is world class.
Thanks so much.
All right, buddy. Take care.
Thanks. Bye.